Welcome to another Nexus Eye Care video. I'm Dr. Phillip Myers. Today we're going to be talking about cataract surgery and intraocular lens choices. And what better way than by speaking with a cataract surgeon. And so today I'm going to invite Dr. Anagha Vaze from Nexus Eye Care to come and chat with me about intraocular lens choices. So Anagha, welcome.
Thank you.
Anagha, thank you for your time. Not everyone knows that when we do a cataract operation and take out the cloudy lens in the eye, the natural lens, that you can't focus and see anything unless you replace it with an artificial lens in the eye. And I guess over the years that we've been operating, the lens choices we've had available to put in the eye have got better and better to give better and better vision. But what is an intraocular lens?
So intraocular lens is essentially an acrylic implant which is placed inside the eye after we remove the opaque cataractous lens. And it's extremely essential for visual rehabilitation because without the intraocular lens, everybody would need to wear thick glasses to see.
So people after cataract surgery,
Yes.
everyone...
Absolutely everyone.
I mean, can you see it? If you look at someone who's had cataract surgery, is it going to affect their appearance?
Absolutely not. Only us, when we actually have a look at them on the slit lamp biomicroscope, which is a microscope, we will really see. A very keen observer might just notice a tiny shimmer in the eye, but it's usually not noticeable, and the general appearance of the patient does not change. In fact, if a patient was wearing glasses before, he might not be wearing the glasses.
Okay, that's something we can talk about. That sounds exciting. Do you find a lot of your patients who have cloudy vision and maybe glare problems driving at night from cataract are coming along and not only hoping to clear the vision and improve the nighttime vision, but they may be hoping to be less reliant on glasses?
Yes, I think there has been a paradigm shift in how we look at cataract surgery. In the previous decades, it used to be just visual rehabilitation and patients used to really have advanced cataract and we needed to do that for them to be able to see. But now it's shifting more and more towards a refractive procedure and patients are hoping to get more spectacle independence. Obviously, that is something we need to think about and discuss with the patient depending on their requirements, their nature of their job, their daily activities. So it is really individualized patient selection and treatment.
Now I know when you're measuring people up for this lens implant, you're mentioning the difference between distance vision and near vision. So what's that about, and what does a patient have to think about when they're thinking about what lens implant to put in the eye?
So say for example, a patient who's a keen golfer, he wants, and also who loves to drive, for example, they're really keen on or want to have clear, sharp distance vision, which means we choose an intraocular lens implant which gives them correction for distance vision, and we have to explain and discuss with them that in that situation they will definitely need reading glasses. Because
these implants are fixed in the eye, they don't change shape like a young natural lens that can change its power from the distance and add extra focus power for near.
Excellent question.
So really the distance vision you give a golfer or something, the problem with that is there's no ability to see up close for reading.
That's absolutely right, and the reason is the natural crystalline lens has got the ability up to the age of 40, approximately 40, to change its shape and the focus from distance to near. So majority of the patients who are emmetropic, which means they do not need prescription for distance and near, are able to manage without the spectacles for most activities and most distances. Now this ability starts deteriorating as the patients age, and it's a part of degenerative change. So that's the reason a lot of patients you will see that need reading glasses. Similarly, the intraocular lens does not have the ability to change that focus from distance to near, but I'm talking about the monofocal intraocular lenses. There are other types of intraocular lens implants available in the market, such as enhanced depth of focus, which means those lenses have the ability to correct distance vision and also give some intermediate distance vision, and they're slightly different optics. And
so that's really useful for
yes,
not only distance driving, golfing, but
computer. Absolutely.
And seeing the dashboard on the car,
yeah.
Shopping, that sort of thing. It probably frees you up from needing to reach for glasses for a lot of time. But I guess there's some things that even an enhanced depth of focus lens implant is not able to do.
Which is near vision, reading up close, reading a book.
So near vision is really reading
at this
and your phone, your tablet.
Absolutely. So that is something the enhanced depth of focus lens can't give. But again, there are other intraocular lens options like the multifocal IOLs or the multifocal intraocular lenses.
So that's interesting. Is a multifocal IOL the same as multifocal glasses? Like, with multifocal glasses, you have to look straight ahead to see in the distance, and if you want to read, you've got to use the multifocal strength down the bottom. Is a multifocal IOL the same?
Not exactly the same, but it works on the similar principles. So it has different optical zones that corrects the vision at different distances. But a lot depends on the lighting conditions, the pupil size, and so not every patient is suitable for those lens choices. So for example, say truck drivers who drive a lot during night time, they might not be the perfect or the suitable candidates for those sort of lenses because, the part of the artificial or the intraocular lens they're looking through might not be the correct one because of the change in the lighting conditions and the pupil size. So those lenses also, while they give you freedom from spectacles and give more range of focus, it comes with a slight compromise, which means a slight reduced contrast sensitivity or color, washed out colors and things like that. So it again all depends on the pre-surgery counseling and what the patient's requirements are. So say for example, a patient who has a completely normal anatomy of the eye, does not have any other associated eye problems, does not need to drive at night, and is really keen on being completely free of spectacles, would be the perfect candidate. Given all the other parameters fit, like once we measure the eyes, measure the cornea, which is the front window of the eye, and all those things. But for example, a patient who has retinal disease, especially macula, which is the central part of the retina, which is responsible for your central vision. If someone has significant macular disease, the central vision is already compromised, and the multifocal lenses can further deteriorate the vision.
Okay, so multifocal implants are not always recommended, especially in conditions like macular degeneration or advanced glaucoma.
Absolutely.
Or other conditions like that. It's really important then to spend time with your surgeon.
Yes.
To find out. Now, would you find that most lenses you put in are monofocal lenses, or do you find most are multifocal? What do most people want?
I think after having this good discussion, I still find like majority of the patients do not want to compromise on the clarity of vision. So majority of the patients will still go for the monofocal. Depending on their requirements, they'll go for distance. A good example for patients who want a better near vision are the short-sighted people who are already used to good near vision without glasses.
So these are people who can read comfortably in bed at night without glasses.
Absolutely.
It would be nice to keep that after cataract surgery.
Absolutely. And we can aim for a target refraction or the prescription after the surgery to suit their requirements. So that's that. But nowadays with the new sort of enhanced depth of focus lenses, and now we have seen that a lot of people are corporate, and in general a lot of people are spending time in front of the screen or the computers. So those patients really do well with the enhanced depth of focus lenses. And I have come across significant patients now wanting to at least discuss that option with me. And that's kind of the next way forward for those patients.
Well, thank you, Anagha. That's been very informative, and I've enjoyed chatting with you, and I hope that's been a helpful and informative session for you watching this video. So if you'd like to know more, please check us out on our website at nexuseyecare.com.au, or please come and see us. Arrange a referral through your GP or optometrist, and we'd be glad to have this discussion with you. Thank you.
Thank you. Thank you, Dr. Myers.